FoRUT has been working in Sierra Leone since 1991, and at that time it was called FoRUT Sierra Leone because it was the program office of FoRUT that is based in Norway. And by 2015, the organization transformed from FoRUT Sierra Leone to Foundation for Rural and Urban Transformation and still maintains the name FoRUT. Our vision is to see a Sierra Leone where everybody enjoys their rights, free from harm, free from alcohol and drug related harm. Our mission is actually to empower citizens, especially children and young people, for them to realize their potential to take up development initiative at their own best interest. Yes, that is one of our thematic focus. We have 5 key thematic areas. Among them is gender equality and also livelihood. We believe that for people to realize their potential, they need to be given the requisite education, the requisite training. Therefore, we enrolled youths in the technical and vocational training, and then those youth that have graduated, we have deliberately selected the female youth for support them in various startup kits. And we believe that after completion they should have the requisite capacity to be independent in their entrepreneurial drive. That is why we have supported youth, especially the female youth, in various technical and vocational initiatives. Yes, our work, I will explain our work based on our key themes. And one is alcohol, drug, and development. Alcohol, drug, and development is actually, we are working on two-pronged approach. First approach is to ensure prevention of alcohol and drug related harm. In that, we work with stakeholders, we work with youth group, we work with the government of Sierra Leone on the basis to focus on prevention. And the other aspect is control. That control is working with relevant stakeholders to have legislative framework in controlling alcohol related harm in Sierra Leone and also drug related harm. This legislative framework on the drug related harm is to review the drug laws in Sierra Leone to reflect the West African drug law model. And that work is ongoing for our laws to be more humane in treating people who use drug with care and compassion. On the alcohol aspect, we've been leading as civil society on the development of an evidence-based national alcohol policy in Sierra Leone. We've worked with the government of Sierra Leone through the Ministry of Health and Sanitation, specifically the Directorate of the Non-Communicable Disease and Mental Health. And Sierra Leone has had the first national alcohol policy, which the government of Sierra Leone launched in 2002. We led that process. The alcohol drug aspect, that is one key area we work on. On child rights, we work on child rights as our theme, and in that theme we believe every child has the rights, the fundamental rights to access education, to complete education, and to be productive members of society.